Tell me about yourself.
My name is Pete Kerber. I'm a 25-year-old student at Hocking College. I'm graduating on June 12th, 2011. During my time in the PTA program, I've completed 3 clinical rotations, all which have been in different settings. My favorite setting was with my first clinical experience at Ohio University's Peden Stadium, where I worked mainly with Ohio University student athletes in performing PT skills.
Why should we hire you for this job position?
I feel that my first clinical experience at Peden Stadium has prepared me well to be in the sports rehab field. My background as an athlete, I feel, has also helped me to help student athletes and just athletes in general rehab. I feel that I can use my experiences of the past to progress patients, through their rehab.
What are your goals, or where do you see yourself in 5 years?
My goals are to eventually earn a DPT, Doctorate in Physical Therapy. Right now, I just would like to enter the job world, gain more experience working in the PT world. Eventually, I would like to complete a bachelor's degree and end up applying to probably Ohio University's physical therapy program. So that's my goal for the next 5 years.
What are your weaknesses or list areas you would like to improve in?
My main weakness, I feel, is just my lack of experience. I feel that this will be solved once I enter the job market. Just overall, I've done 3 rotations, but I still, that's only a couple months worth of working experience. I feel as though I have a couple years of working experience under my belt, then I will definitely be much improved in the world of PT.
Tell me about a recent conflict you've encountered and how you've handled it.
Recent conflict, when I was doing my final clinical at Ohio Orthopedic Center, we had a woman that was recovering from a total knee replacement. My CI and I performed the eval, and she told us that she would like to stay with us, as in me and my CI, throughout the rehab, but she was ended up putting on a female's patient load. She wasn't very happy about this, and she confronted one of our PTs about it. I volunteered to take her up as my own patient because she didn't like working with a female. She was not combative or any, mad or anything like that. So that was one of the conflicts that I encountered in the clinic.
Why have you chosen this particular field?
I chose physical therapy because I like working with the human body. I'm fascinated by the anatomy of it. I feel that one of my biggest strengths are the functional aspects of the human body and how it works. I like to lift, so I take what I've learned in anatomy and kinesiology, translate that, and I feel that that gives me a better understanding of how the rehab world works.
Describe an experience in which you worked as part of a team.
In my last clinical at Ohio Orthopedic, I was a part of a 5-man crew. It was the director, my CI, and one other physical therapist, and then 3 PTEAs. We all worked together treating the same patients, and you had to conduct yourself as a team in order to have the treatment sessions go fluidly and smooth. The team aspect was stressed at that clinical due to the fact that everybody saw the same patients, so we all had to work together to help progress our patients.
Explain with an example how you are adaptable to a wide variety of roles, situations, and environments.
Well, just throughout my 3 clinical rotations, they were all different. The first one would be, the sports rehab at Peden Stadium. The second clinical I was at a nursing home, which is an entirely different patient load, mainly geriatric patients. The third was a post-surgical rehab center that was owned by 3 or 4 orthopedic surgeons, and we saw mainly post-operative knee operations, shoulder operations, a few ankle and wrist surgeries. I feel that, being put into different clinical situations as in inpatient and outpatient have made me adaptable to different PT locations.
What is your most notable accomplishment?
As of right now, it's going to be graduating from the Hocking College's PTA program. This is a pretty strenuous course, and I've felt that, it's pretty much pushed us to the limit throughout our time here, and pretty proud to be a graduate of it.
What is your ideal work environment?
My ideal work environment would have to be in a sports rehab clinic. I really enjoy working with athletes just because they seem to possess a greater want to get better. Their goals are generally set higher than an average outpatient facility. That's sort of what helps me. It sort of helps me to work with them, to be just more interested in working with them than just an average outpatient facility.
What are the most important qualities for a PTA to have?
I feel that they have to have a positive understanding of, each patient is their own case. You can't treat two patients the same just because they might both be total knee replacements or, a shoulder scope. You have to conduct yourself as each patient is different, and you have to take them on as a different case. Even if it may be the same surgery, you still have to consider them to be, an individual within their case.
Thank you so much for this interview.
Thank you.